Hey, Dr. Berg here. In this video, I'm going to talk about right shoulder pain. Now, many of you have this right muscle thing right here that just irritates the heck out of you, and you go home and your spouse massages that thing. You go to a massage therapist and you're working on this muscle. You go to the chiropractor, get it adjusted, and it keeps coming back. It's on the right side. It's this little ropey, tight muscle right up by the scapula right here. The name of that muscle is called the levator anguli scapular muscle, so it pulls this little bone up here in the shoulder. And sometimes you might have pain at this rhomboid right next to the scapula right here. And that's a very common thing. And I want to show you what's really behind that. It's actually something called referred pain. It's not coming from this area at all. It's coming from something called your gallbladder and your liver, because that's right behind it, and there's a little nerve that goes right through there. Let me show you. Okay, so check this out. We have the little liver right here. The liver is about right here. It's about the size of a football, about 3 pounds. It's huge. And then it has a little tube that connects to this gallbladder, right? And the gallbladder is there to hold and release something called bile. B-I-L-E. That helps you digest fatty foods. It helps you do a lot of things. It extracts nutrients from fat, especially the fat-soluble vitamins, vitamin A, D, E, K, that type of thing. So what happens, what's really going on with this right neck thing, it's being referred by the gallbladder. Now, some of you might say, well, I've never been diagnosed with the gallbladder problem. I don't have stones, but stones are the last thing that occur after gallbladder and liver dysfunction. It just starts on a sequence of little small things that build up over time. And I think that's the problem with going to the doctor. He'll say, well, come back in 6 months when you have the problem and then we'll properly remove your gallbladder. They're not doing anything actively right now to save the gallbladder. The gallbladder gets beaten up by junk foods, by alcohol, by eating breads and pasta and cereal and crackers. So it's really the crap that we're eating that messes this gallbladder up. And you know, I have people all day long that come in that say, well, when can I go back to drinking alcohol, or when can I go back to eating real foods? Well, just as long as you want a healthy liver. I mean, unfortunately, when you take away things like alcohol or junk food, a lot of things come up. And I think people don't even realize how addicted they are to those things, especially even alcohol. I had a guy a couple weeks ago who he says, I have a craving for alcohol. Come to find out, he does it almost every single night. And so he starts the program, and I probably shouldn't have taken him on because that so-called craving was really an addiction. An addiction is something you cannot give up, and you're doing excessively. And so it's interesting, I found out after he came in, the next day, he went back to drinking. The next day he drank. Over the weekend he drank the next day. And then he was complaining that the program didn't work. And he told me he was drinking. So, and the interesting thing that happens when patients cheat on their diet or they go off the program, they have to justify it in their mind. And so what they have to do is they have to basically become very critical. And so he went on social media and made some comments about me, whatever. But the truth is that he went off the program's not going to work, so he has to justify it by criticizing someone else. So that's what really happened. But the key is that alcohol does mess up the liver and the gallbladder, but it needs certain things to help repair it. And probably one of the best things to help repair a gallbladder and liver would be things like bitter cruciferous vegetables. At the top of the list, the best thing for the liver would be beet tops. So if you were to buy beets at the grocery store or farmer's market and cut off those beet tops and cut those up and put those in your salad or in your kale shake, oh my gosh, that would be the best thing for the gallbladder and liver because it'll start to rebuild that thing back up. But you're going to have to come off that alcohol if you have a congested gallbladder, especially if you have this. So now, how do you know it's getting better? Well, this is a really good kind of an indicator to know your liver and your gallbladder is doing better by how this feels. If this does better, then we know it's better. If it still hurts, then there's still a problem with this. So you might have to, really work on this over time. The liver is probably one of the only organs that can completely regenerate 100% if you give it time. And so I did have another guy call me up and he says, well, Dr. Berg, your program doesn't work, because I did it. And as soon as I went back to my normal eating, the problem came back. I was like, really? I said, you did it for 2 weeks. You got to do this thing for a lot longer. It takes up to 3 years of healthy eating to repair the liver. And I think that's, some people don't understand how long it takes. Like if you have osteoporosis, like your bones are completely thin, and you start taking calcium for a few weeks, you're not going to see any change. It takes years of building back up those minerals, because osteoporosis is a very serious mineral deficiency, and other deficiencies as well. Well, the liver takes years to build up too, and that thing takes years to come back. Just because it doesn't show up on a blood test doesn't mean that your liver is healthy. You have to basically have 90% of your liver to be dysfunctional before you even notice any symptoms on a blood test. So it can be completely fatty and you're feeling fine, so to speak. So you really have to kind of eat healthy now and prevent issues. I mean, there's never a week that goes by that someone says, yeah, my friend just got cancer, she had no symptoms, and she has cancer, and now she has to go through chemo. I don't want to wake up one day and have cancer. I don't want to wake up and have a stroke. I want to actively, aggressively get my body healthy every day to prevent and avoid all these issues. But this gallbladder and liver is one of the best indicators, is the whole right shoulder neck thing. So you really want to get your lifestyle in a place where find other pleasures, other than junk food and alcohol. Now, can you ever drink alcohol again? Well, why don't you just get the liver healthy and then see what you can get away with down the road. But first, let's focus on creating health. So this is the real cause to a lot of right shoulder stuff. And if that thing is really messed up, it can even cause so much tension up there, it can cause the vertebra to rotate out and cause bones to even literally go out of place and cause nerve pain down the shoulder, the whole thing. But the point is that I personally had this problem for about 12 years. I didn't know what it was until I started to take care of my liver. And oh my gosh, I thought it was an injury because I was right-sided, I was a tennis player, I was a wrestler. Yes, I had those injuries, but this was really behind the situation. So what is the bottom line? The bottom line is take care of your liver and your gallbladder and listen to your body, listen to what it tells you, don't ignore it, and understand what certain things mean. This muscle thing right here means gallbladder, okay? So in addition to consuming bitter vegetables, you may want to try a remedy I have. It's called the gallbladder formula. I developed this basically for myself, for my liver. It's not just for the gallbladder though. It has 3 main ingredients. One is purified bile salts to give you more bile, to help dissolve all that crud that's in the gallbladder, to prevent stones, absorb nutrients, vitamin A, D, E, K1, K2. So those are all key nutrients that you need for nutrient absorption. But it also has an acidifier for the stomach because in order to release the bile, the stomach needs to be really, really acid. So this has betaine hydrochloride to help your own body make more bile from the stomach level. And also it has pancreatic enzymes to help the pancreas dissolve nutrients too. Well, one of the indications that you need pancreas enzymes is that if you eliminate food through the waste and it doesn't digest, like you might see undigested food in your waste, then it's really a pancreas problem. So it has all 3 elements for the stomach, gallbladder, pancreas, but it also has in here stone root, if there's a stone in the gallbladder. It has things to thin the bile. So it's really good for bloating. And I might just take 1 as a maintenance for breakfast. Some people, if it's real bad, they might take 1 with each meal. But basically, you just start with taking 1 for breakfast, and you just take it right before you eat. And then you'll notice that your digestion, you'll feel more satisfied when you eat. You won't crave sweets after eating. You'll feel less bloated. And this big ropey thing will start going down, down, down. But this doesn't give you the permission to start drinking and eating junk, but it allows you to get some relief as you're cleaning up your diet. So you may want to check it out and try it. So thanks for watching, and I will see you in the next video.